We are now live. Welcome to our Instagram live with Dr. Webster and Ash, Dr. L, your double board certified facial plastic surgeon, and we're gonna bust some myths and tell you some truths about hair loss. We want to thank all of you who submitted your questions. So I'm going to start with one which is super common that we ask. When men come to us, they ask us if they wear a cap or a hat, if that causes hair loss. It does not. Is that a myth or truth?
Myth.
It's a myth. So we see a lot of men who have hair loss who wear caps to basically prevent their hair loss from showing up, or a lot of us just wear it for sun protection, and it does not contribute to your hair loss. It does not cut circulation, and hair loss, the majority of cases are androgenetic, so female and male pattern hair loss, and it can look in the distribution of the cap because it's like that, but it's because the hair, thank you for everybody waving, but it's because the hair that's prone to hair loss is DHT or dihydrotestosterone sensitive is in that distribution. So feel free to wear your baseball caps without worrying about it. All right, next myth. Dr. Webster is going to come forward.
By the way, if any of you guys have questions, feel free to drop them below and we will definitely answer them for you. But the next, I'll go for it. The next myth is that a lot of people believe, that hair loss is only transferred by your mom's side of the family. No, this is partially true because the gene for hair loss is on what we call the X chromosome, and the X chromosome is what we get from our mother's side. But there's a lot of other genetic factors that play a role in hair loss that is not fully understood yet. So definitely, if your dad or your dad's side of the family has hair loss, you can be prone to hair loss as well. It's not only inherited from your mom's side. Ash, you're up.
The next myth is that excessive washing can cause or accelerate hair loss. Now that is a
myth.
Myth.
And although excessive heat and some harsh chemicals can damage the hairs and cause temporary hair loss, it won't accelerate genetic hair loss or even hormonal hair loss. We do recommend some of the shampoos that we have, Viviscal, Dandrine. They're very neutral and balance the pH of your scalp very well. So they're good for the quality of the hair, but it won't affect the hair loss directly.
All right, the next one is, let me think. Can hairstyles contribute to hair loss? Is that a myth or a truth, Dr. Webster?
That is a myth. I mean,
I disagree. It is, well, it depends.
Depends.
It's a truth. So actually, if you braid your hair really tight, so tight braids or even tight hairstyles like mine, if you pull it really harsh, can cause something called traction alopecia. So you can see in a lot of females that we put our hair up, and if you put it in a lot of tension, it can actually cause, and it's very common in the temples. So even though I put my hair up, I always make sure I pull my hair so that it's not super tight, and I make it look like it's tight by applying gel, but the traction is not actually coming from this part of the hair. So be careful if you get lots of braids in your hair, or you put your hair up like me, not to put it in too much tension to prevent traction alopecia. All right, Dr. Webster, you're up.
I'm up. A really common myth that we see is a lot of people use Rogaine, also known as Minoxidil, and there's this common thing that if you stop, all your hair falls out immediately. What do you guys say about that? Is that myth? Truth?
Myth.
Yeah, it's somewhat a myth. You're not going to lose... Go ahead.
No.
You're not going to lose all of your hair immediately, but as with any treatment, if you do stop doing that treatment, your hair is going to revert to what it was before you started the treatment. So it's not per se that you're using Minoxidil, you stop and you lose all your hair and you go back to worse than what you were before. But if you stop, you're going to go back to that baseline point that you were at when you started the Minoxidil, especially if you're dealing with androgenetic alopecia, because that is a progressive illness. So if you do stop Minoxidil with that, your hair will revert. So you will have some shedding for sure, but you're not going to lose all your hair immediately.
All right, Ash, you're up.
The next question is, so a lot of patients come in at a young age, maybe around 20, 21, and they have very, very mild signs of hair loss. And the question is it true that they have time to wait, the luxury of waiting before treatment? Is that a myth? Or
definitely a myth. It's not a truth. You should get treatment as soon as possible. And that was actually, you stole mine.
Oh, really?
Yes. So a lot of people think hair loss is for, as we get more mature or older, but it can start as early as in your teens. So it's really important to get the correct diagnosis and to have the treatment options and treat it as soon as possible. Now, there's another myth that I can only do topical therapy or PRP, but there are so many treatment options. One thing that I wanted to see if I'll jump in with the next one. Can diet or nutritional deficiencies contribute to hair loss? Is that truth or myth?
That is truth.
100%.
Yes, that is so important. Things that we're really careful about, and that's why in consultation we ask about your diet. We do blood work to see if there are any deficiencies. The very common things are vitamin D and iron. A lot of us are deficient, especially living in a place like Vancouver. We don't get a lot of sunshine, so for vitamin D, I actually recommend everybody to supplement with at least 2,000 international units. Not only can help you with your hair growth, but it can also result in prevention of cancer. It's actually one of the only supplementations that can do that. So if you're listening, please, if you're at Whole Foods we carry really good vitamin D from Cytometrics, but I don't care where you get it from. I want you to supplement 2,000 international units per day. The other common one is iron or ferritin, and it can be both in males and females, especially if you have a restrictive diet and you don't eat a lot of red meat or leafy vegetables. But also in females, when I talk to my patients or our patients, a lot of them can have heavy menstrual cycles, and that can result into a low iron, and that iron deficiency can result in hair loss. And there are a lot of other vitamins. We check your magnesium, we check your zinc level, but the two most important ones are vitamin D as well as ferritin. So it's important to check those. We also, Dr. Stapleton does iron infusion, so if anybody out there requires that, let us know. And just on that topic, there are a lot of vitamins out there that are claiming to help with your hair regrowth, and a lot of people invest a lot. My biggest thing as a double board certified facial plastic surgeon is that whatever I ask my patients to use, I want to make sure it's effective. So there are two brands that have double-blind randomized controlled trials that we have researched that they actually work. The one we carry is Viviscal, and then there's another one, Nutrafol, and so those two definitely help, but just be mindful of your investment and the results.
Just to add to that, a common thing that we see is that a lot of patients come in and there's an underlying issue of genetic hair loss, and actually those nutritional deficiencies actually tend to speed that up and trigger that to come on. So it's really important, even if your diet and nutrition is not the sole cause of your hair loss, but it can actually worsen your genetic hair loss as well, and kind of speed up that process. So make sure to get your blood work done and come see us.
Okay. Perfect. Ash, anything to add?
Maybe one last myth or fact is that I have to use finasteride or minoxidil in order to treat my hair loss. Is that a myth or a fact?
I say it's a myth. There's no have to or must in treatment of hair loss. It has to be really tailored towards the diagnosis. We also go over your beliefs and your approach. We have patients that do not want to take medications, and we have natural ways of supporting your hair regrowth, including platelet-rich plasma, which comes from your own blood, microneedling, which we're seeing amazing results with scalp microneedling, as well as vitamin mesotherapy, red light therapy. There are so many options for treatment of hair loss, and in some patients, topical therapy as well as oral or topical finasteride can be helpful. But we will go over, it also depends on your age, your work and life schedule, and we tailor it based on you. So it's really important to know that you have many options. But one thing is that we know that multimodality treatment gives us better results. So it's really important. A lot of patients do one thing. Let's say they do topical therapy or they just do PRP. So we know that if you combine the treatments, we can give you superior results. So at least two to three things for treatment of your hair loss. But the most important thing, be educated and see us or a healthcare provider that specializes in hair loss as soon as possible to get a correct diagnosis, blood work and workup, including trichoscopy to get to know your treatment options, and then you're always in charge of that. All right.
Perfect.
This was a lot of fun. We're gonna do this more, and we're actually planning to do IG lives every Monday. You may not get the 3 of us all the time, but we want to be talking to you. We want to be answering your questions. So you know that we answer our DMs very quickly and promptly. All of us do. So send us your questions. Tell us what topics you want us to discuss, and we'll do more IG lives and educational videos like this. Thank you for everyone who showed up. And I'll go and wave at everybody at the end, and let's see if anybody put any questions that we need to answer. I think there are mostly waves and hearts. Oh, Alexis says you guys are the best. We look forward to seeing you. Okay, perfect. I think this was great.
Yep. Thank you guys.
Awesome. Thank you, everyone.
All right.
Take
Cheers.
care.
Bye bye.
Happy Monday.
Monday.
Happy Monday. Have a beautiful week. See you later.